News Talk 1400 KFRU. We regularly do a segment with the MU Interdisciplinary Center on Aging. And Peggy Gray, who's the program coordinator there, you always come up with some good topics. It's a good one again today. Good to see you.
Good to see you, David.
Let's jump right into it because your guest is Jane Armour. Do you want to do a good introduction of our guest for us?
Well, she's
Dr.
got
Armour?
lots of good things to tell us, so I'll just make this brief. Dr. Jane Armour is a professor in the Sinclair School of Nursing at the University of Missouri, and she's the director of the American Lymphedema Framework Project.
Lymphedema Framework Project. Why don't we stop right there and have you explain what that is, Dr. Armour? First of all, welcome. It's good to meet you.
It's wonderful to be here, David. Thank you very much, Peggy. The Lymphedema Framework is a national coalition of stakeholders in the area of lymphedema, which is that lymph-related swelling that can occur.
Edema is swelling.
Yes.
Lymph responds to, or the lymph.
Swelling related to the lymphatic system.
Yep.
That protein-rich fluid that's in our throughout our body.
When is lymphedema? When does it show up? What's it a sign of, or what's it a result of?
Well, lymphedema is a complicated condition, but it can appear from birth as a primary condition. The most frequent occurrence, though, is following cancer treatment. We call that a secondary lymphedema. It can occur after trauma, like a car accident, sports injury, but most often it's after cancer treatment because of changes in the lymphatic system related to surgery or radiation or infection, some kind of trauma that occurs during that process.
Is it the lymphatic system trying to rebel? Is it trying to heal? Is it trying to what is it trying to do that makes it go through this?
The lymphatic system is a one-way system. It goes from the faraway parts of our body back to the center of our body, unlike the venous arterial system, which is a two-way system. So the lymphatic system's only coming back toward the center of the body. So if there's a disruption, like a cutting of the lymphatic vessel or obstruction due to a tumor or due to fibrosis after radiation treatment, the fluid has difficulty going from that faraway part back to the center, and that's where we get the lymphedema.
Wow. Is it painful?
It can be. It isn't necessarily. It's often a visible swelling. There can be symptoms of tingling or numbness, most often a symptom perhaps of heaviness of that limb or that body part. It doesn't feel quite like it did before, and the person may be the first to be aware that there's a change. Even before we can measure a change, they may feel these subtle symptoms that something isn't the same in that part of the body.
Does it accompany most cancer or specific types of cancer?
Breast cancer is actually the most frequent a relationship, and that's because of the large numbers of breast cancer cases and the high survivorship we have in breast cancer. That 90 to 95% of women will survive more than 5 years. A diagnosis of breast cancer if it's caught early, and so women with breast cancer treatment are the most common population to develop this. That's one reason we have focused our research in that area. We think surveillance and early awareness will lead to better outcomes.
Does it go away by itself?
Most often not. There can be transitional or coming and going of swelling, but once it becomes chronic, once it's there every day, it needs to be managed, but it will not probably go away. It will. There's management for it, but it becomes a chronic condition.
Next question would be, how do you manage it? Is it through medicine or is it through activity?
It's actually through comprehensive or complete decongestive physiotherapy, CDT, we call it. So it's a 5-stage program, but there's manual lymphatic drainage, like a very gentle massage. There's compression, bandaging and garments, good skin care to prevent infection, exercise, physical activity, and then good nutrition, overall good health is a part of that.
Jane Armour is our guest, and again, professor of nursing at MU Sinclair School of Nursing, director of the American Lymphedema Framework Project. You mentioned research a while ago. What kind of research are you doing? How are you working on this?
For over 15 years now, we've studied breast cancer survivors, and we're one of the longest, or perhaps the longest running study following people from the time of diagnosis through the years of survivorship. We've enrolled in our study 350 women newly diagnosed with breast cancer, and so we followed the emergence of lymphedema, the treatment and the self-management of lymphedema. Right now, the program that we're doing with the Interdisciplinary Center on Aging is focused on physical activity during survivorship. So 7-10 years after breast cancer, what are women doing in terms of staying active? How is their lymphedema, or have they not had lymphedema during this period of time? How are their patterns of activity different as they age, as they kind of age in place?
Do you have preliminary findings of this?
We just have begun the data collection in the summer.
I see.
And we'll continue through next summer. We'll be following up with our patients.
Do you start something like this already with an assumption in mind as you get ready to go, what you think you will find?
Well, we always are current with the literature. We try to stay current with the literature. And what we have found, and what makes it safe for us to do this study, is that we have found from our literature that it's not dangerous to be doing normal physical activity. There were years in which we cautioned women to not do certain things, but there are some nice studies out of Penn that have shown that with careful guidance that women can resume activity in the gymnasium, and do it in lifting weights with guidance and be physically active.
You mean within a certain amount of time after breast surgery, or breast cancer surgery about breast cancer?
Right.
But we've always underestimated the physical ability of women, it seems like, from the beginning. With athletic events, not including them or not letting them run certain distances or do certain activities, perhaps in an Olympic type of venue. So the same thing would be true here, although I can understand the hesitation after somebody has gone through a traumatic situation with breast cancer. But it's okay, huh?
The key really is careful guidance and reconditioning. So there are very few things you cannot do, but it's a matter of gradually reconditioning the body. We have women in our study that have said, I'm afraid to pick up my grandchild. I can't carry the dog food bag. I can't carry my groceries in. And we find that if it's something that women are conditioned to and they were doing before, after they have healed, they should be able to resume doing that. They should be able to play golf and ride a horse and do those things that are important to them.
So is it important that any woman who's had breast cancer treatment work with, say, a physical therapist after she's gone through her treatment?
I think that's an excellent point, Peggy, and it would certainly be recommended to do a baseline assessment with a therapist to see not only what limb volume is, but what the strength is and the flexibility, and to have an individualized plan for physical activity. Even if there's no lymphedema, that's a very good plan for life and for continuing your functional abilities.
What is the rate of lymphedema to those who have had breast cancer surgery?
That's really a big question that's hard to answer in a simple statement. It could be from as low as 3% in the year after breast cancer, if only one lymph node was sampled and small tissue was taken and no radiation. There are studies that show it could be 87% if someone had infection in the post-op course. We would say, the medical literature would say probably 20 to 40%, which is a very large number when you look at 2 million breast cancer survivors in this country.
Are people who have had breast cancer surgery alerted to this and say, okay, be alert, because one of the things that might happen after you start your road to recovery would be you could get lymphedema. Here's what it is. Here's what it might mean. Are they prepared for this?
That is an excellent question. More and more so, that's happening. It's actually a word on the consent form before someone goes to surgery.
Oh, to say that
this could be a post-op complication. Women don't often remember that because of all the information they're getting. I'd like to share that a very innovative program in effect at Ellis Fischel Cancer Center is that they've taken the protocols we've done in the research setting, and they have a prospective surveillance model where they're offering to their patients to follow them for lymphedema swelling and symptoms over the first year of their treatment, and that's a new model that we're seeing across the country.
That seems like it would make sense.
Yes.
I mean, that's what you need to do. I mean, to prepare people, especially if it's 20 to 40% who might have this afterwards. How quickly does it show up after?
Another very good question. The average time from our data would be, say, 6 to 9 months, but it's also a lifetime risk. It could be 20 years later. In the literature, we see it that far out. And our data that goes now to 7 to 10 years later, we see new cases less often. We do see new cases later, like at 60 months or at 7 years.
Wow, people would have to, I mean, that's a long time out.
It is. And maybe there was a precipitating event, like another injury of some kind or an infection. something else that occurred, but we know there's some underlying damage in many cases to the lymphatic system. So then something else increases the burden, and then it emerges.
So my next question would be, is research being done at the front end of this treatment, the surgery, where doctors would go into saying, all right, what might we do not only to take the cancer out, but also not to trigger something from the lymphatic system that would lead to this later? You understand what I'm asking?
Another excellent question. You know, if we had all the money and resources and we did a dye study of the lymphatic system before we removed a tumor, we could avoid the main collectors from being transected or affected. That's an expensive process, and not every center will have that equipment and the diagnosticians readily available. But we are looking at possibilities for trying to avoid damage to the lymphatics. And even ahead of that, we're doing some work genetically to look at whether some women might be a higher predisposition due to maybe having differences in the function of the lymphatic system or the anatomy and physiology of the lymphatic system, or the ability to repair itself and develop some collateral circulation. So we've done some work in the last few years in genetics.
Wow.
I'll tell you what, this is amazing because this is Breast Cancer Awareness Month, and so this fits in perfectly.
Yes.
But at the same time, I'd never, ever heard the discussion about lymphedema in regard to post-cancer treatment or anything like that.
It's like the tip of an iceberg. We don't talk about it very much, and there's so much in those years of survivorship that we have yet to learn, and really to increase awareness and to engage our whole healthcare team.
And I have many friends who have unfortunately been suffering from lymphedema following breast cancer treatment. And it's not something that was on my radar until a friend started having issues with it, and then I realized this can be very devastating.
Did they know what was going on, or they have to say, I don't know what's happening here, but something's not right. Tell me what this is.
Well, they would discuss it with their doctor, and it was almost, I'm not going to say it was passed off as being nothing, but it was just said, oh yes, the swelling that comes with your treatment. But it's more than that. It's a deeper issue than that.
It is. It can affect function to the effect that people need assistance with daily activities. It can affect what jobs we choose to do.
Sure.
We may change our job or recreational activities or family activities.
We'll have to come back when you've delved deeper into the research to find out what it's showing, okay?
We'd love to do that. Thank you.
Dr. Jane Armour, who is a professor of nursing at MU School, Sinclair School of Nursing, director of the American Lymphedema Framework Project, about the research she's doing on this issue. It's a good one. And Peggy Gray from the MU Interdisciplinary Center on Aging. Thanks for bringing Dr. Armour to us today.